everyone, it's Kelly, and today is February 28th, which is Rare Disease Awareness Day. I know, it's very, very exciting, and obviously not exciting that we are sick and we have rare diseases, but the fact that we have a day for awareness, that's pretty good. So, better get started on some things that I want to talk about with rare diseases and why it's difficult and why we need more awareness with it so that they're not so rare anymore, so we can have hope for a cure too. Okay, so the very first thing that I want to talk about with rare diseases is symptoms. Symptoms of rare diseases are very confusing for the patient and for doctors because usually the symptoms are not textbook, meaning, you know, whatever they learned in medical school, that is not how our bodies work, you know, so it confuses doctors, makes them think, you know, they don't understand our situation. And it's frustrating for us because we can't get answers. Usually, people with rare diseases, it takes them a very long time, usually months to years to get diagnosis, to get the correct diagnosis. Usually, people with rare diseases jump from diagnosis to diagnosis, they jump all around from doctor to doctors, and they usually are undiagnosed for a long time and sometimes even get misdiagnosed a couple times. So it's very important that doctors kind of realize when it's more of a rare disease. Usually through genetic testing and detailed blood work they can tell if it's more rare and that it needs more of a specialist involved in your care. So that's frustrating, symptoms, because a lot of the symptoms are also unusual, or they're unspecified. Like a lot of the same symptoms would be like dizziness, blurry vision, like lightheaded, anemic, like the same, like it's just a bunch of just a bunch of symptoms, and usually they're not really specified to any one type of disease. Usually it's like all those symptoms plus a boatload of other ones, and it's like your whole body's involved and no one understands why, and you might react really badly to treatments because your body is just all out of whack and no one can figure it out. And I can raise my hand and say, yep, I'm definitely a rare disease, check, yep. Another thing is, well, diagnosis, I just talked about that. Diagnosis can be very hard because it's so rare and out there that not a lot of doctors are informed about rare diseases and their symptoms and, you know, what to look for in a person with a rare disease. Also, because of that, it is hard to find a doctor to help you. Usually, in order to find a doctor to help you with your certain rare disease, usually you have to travel. You have to travel out of your state or out of your country to get help. And because of that, because of how rare the diseases are, it also makes the doctors who are specialists in them rare as well, which makes the waiting time for your appointment usually very long too. So not only do we have a special rare disease that, you know, makes it difficult for everything anyway, but now we have to wait patiently for our turn in the waiting line of seeing the specialist, and usually it can take up to 6 months sometimes to get an appointment. So that can be very hard to understand too, because we're sick too, but we have to wait longer and we get treated differently because we have rare diseases and because it's not so known. And that's not really fair, you know, we didn't bring this upon us, but that's why we need more awareness so that we have hope for getting better treatments and stuff too. So on that note, treatments are usually very non-specific. Usually because it's rare, it has something to do with like the blood or something to do with genetics, usually something to do with, you know, immunology, something that's very like more detailed. It's not just like a regular just workup of blood and like, oh, there it is. Like, no. We're not textbooks, so it's really hard to find out what's wrong with us, and which makes it really hard to treat us. Because it's so rare, no one does research on treatments for us. No one does research for stuff that not a lot of people have, because they can help a lot more people who have bigger things that are more known. So that's really hard for us because the treatments, it usually is a lot of guessing and just kind of like, let's just see what happens, you know, with you on it. And so you're not really pinpointing the right things, you're just kind of treating just what you think is going on in that spectrum of symptoms and, you know, everything like that. So that can be frustrating because you feel like a little guinea pig, you feel like a, you know, science lab rat, because they're just constantly throwing stuff at you and you're just taking it because you want a chance at feeling better, so you're just like, okay, I have to take it, you know. But it's very frustrating because we have to deal with a lot more side effects and stuff because our bodies are so chemically challenged and so different that usually, since our problems are more deep and underlying, it can cause a lot more symptomatic things with side effects and stuff like that. So that can be really hard. It can be difficult to be recognized, which means that like, let's say you go to the hospital because you're not feeling well. Well, the doctor sees in your chart that you have Zitsifrats and it's a very rare disease. He doesn't even know what it is. The doctor doesn't even know what it is. He doesn't know how to treat it. He's never had a patient with it. And you just feel like you're undiagnosed again, you know? And that's really hard because it's like, I know I keep saying it's really hard, it's really frustrating, but it is. Rare diseases are just that. It's frustrating. It's not fair, but we're the special ones, and I guess that just means we're really strong. I don't know. But it's really hard because you're undiagnosed for so long because of, you know, how hard it is to diagnose the rare disease, but then after you get diagnosed, you feel like you're still undiagnosed because of the way they treat you still, because it's not like they have a set treatment plan or a set thing for pain or for your organs or anything. It's just, you know, just throwing drugs at you like, oh, this is gonna work, this is gonna work. Let's just see. It's not like it's our life or anything. Nothing really important, you know. My rare disease is still very rare. We don't know what it is. We're still trying to find the underlying rare disease. So I'm actually going to be going to Texas in April, and we're going to be seeing a specialist there. So I live in Florida, so we are traveling. Like I said, you usually have to travel to find someone to help you. So that's what I'll be doing in April, and hopefully they can get things more looked into my genetics and all that stuff. So, you know, crossing my fingers with that one. But yeah, so I just wanted to make a video about rare diseases because it is Rare Disease Awareness Day, and I wish we had more than just a day, but you know, a day is better than nothing, so I really feel like we have to stick together and make a difference with this. So I hope that you guys spread awareness and you guys, you know, make posts or videos, or, you know, spread this video, whatever you want to do. It's your time to shine and it's your day, so make the most of it and let people know that living with rare disease is very, very difficult to live with, and that we need hope. We need help. You know, we can't do this on our own, and we need big numbers of people to recognize us and to realize that just because we're rare, we're special and unique, those are all good features, but not when it comes to diseases. That just, it makes it really hard to have hope. But just remember to never give up, because you have to be one empowering and strong patient to have a rare disease. So just make sure you realize that you are very, very strong, and I am so happy that you guys have fought this far. And just don't give up and always have hope no matter what happens, and we'll just stick together and keep fighting. Alright, you guys, I love you and I hope you have a great day. Bye!